some more people coming in. Tonight, so I just want to first of all say welcome to our health talk. Tonight we're going to be talking about sciatic pain. I hope you guys can all hear me clearly. So we hold these condition-specific talks on the third Wednesday of every month. And this talk is going to be live recorded on Zoom and Facebook. Now, when you're on Zoom, your videos and audios have been muted for that reason, but the chat rooms are still open. So during this talk, if you guys have any questions regarding anything, you guys can go ahead and leave them in the chat log, and then we'll do our best to get to them at the end. And those of you viewing this live on Facebook, you guys can leave questions in the comments below, and we'll do our best to get that. There's a little bit of a lag time on Facebook. We'll try our best. Now, this talk is going to be roughly 25 to 30 minutes. There's going to be a short question and answer period at the end. So let's begin. Great. So for tonight's agenda, we're going to be talking about first, mainly, what is sciatic pain? How do we identify it? It's going to be really important because it's going to really determine where the major problems are. We're going to talk about how it's caused. We're going to talk about what exercises that you can do to help with your sciatic pain, and then also what you can do to prevent your sciatic pain from getting worse. Now, here's a quote from William Shakespeare. I found this while doing research, and I thought it was really funny. He says, "Thou cold sciatica, cripple our senators. The limbs may halt as lamely as their manners." He wrote this in the Timon of Athens, and this play was performed roughly 400 years ago. And I found it really funny because William Shakespeare thought of sciatic pain as being so excruciating that he cursed others with it. And, I went into some more research, and I found out that during those times, modern medicine wasn't around. And they actually used to treat sciatic pain with bloodletting of the saphenous vein, which is a vein that runs along that sciatic nerve. So we're just going to go through some more fun facts about sciatic pain. So did you know that your sciatic nerve is the longest, also, and the widest nerve in your entire body? And it's as thick as your pinky finger. So this leaves some room for potential problems, because if this nerve is so big, potentially it has more room to or compress. As many as 40% of people in their life will get sciatic pain at one point or the other, and it becomes more frequent as you age. That's due to generation throughout the spine. And then eating an unhealthy diet over long periods of time, particularly sugar and gluten, we're going to talk about that as well, can damage your nerves, leading to sciatic pain. So what is sciatic pain? And this picture is just a very generalized idea of where it happens. So sciatic pain, otherwise known as sciatica, is simply just when your sciatic nerve becomes irritated in one way or another, and it produces this radiating like symptoms down the back of your leg, go down into your feet as well. So we characterize it as a pain that can originate in the low back or the buttocks region, and it travels down either one or both legs. The sciatic pain can vary in frequency and intensity. It can be anywhere from minimal to severe pain, or it can be occasional or constant. So there's a wide variety. It all depends on where it's being compressed, how it's being compressed, and how, the extent of the injury. It can be also described as a variety of different ways. So dull, achy, sharp. Some even describe it as tooth-like pain or tooth aching-like pain. You have pins and needles, numbness, burning sensation. This is generally common with a lot of nerve pains, okay? Also tingling as well. Now, there's a common misconception about sciatica in general, and that people think that sciatica is a disorder in itself. And it's commonly used in that way in medical literature. However, though, sciatica is actually really the symptoms of a disorder, meaning that there's something else that is causing you to have your sciatic like pain. And we're going to get into what those causes are. So, how is it caused? And for that, we need to just know a little bit about general anatomy and how your spine normally is and normally works. So the picture on the left, I hope you guys can see this. I'm going to use my pointer here. The picture on the left shows us what the ideal healthy spine looks like. You have the vertebra, which are these backbones, and it's separated by the blue area, which is your discs. And this is considered a spine that has good, healthy discs, nice curves. But I want you to focus in on these little holes that the articulations form. This is called your intervertebral foramina. Okay. Now, the reason I point out to these holes in your spine is because if you look onto the right, this is where your nerve, right? The nerve of that segment exits out of your spine. So what lives in your spine? It's your spinal cord. And at different levels of your spine, it will exit, and those nerves will either attach to muscles or organs. Now, when you have misalignments in your spine, or your sacrum, or your pelvis, your nerves can become entrapped. There's not too much room within these little circles, and I think I have an animation. Good. Yeah, this is a great description of it. So, as you can see, as your bone becomes more and more misaligned, if you look at the size of this intervertebral foramina, remember this is where the nerve exits out of the spine, it gets smaller and smaller. The other thing that I want to show is as this disc becomes red, right? So as you begin to have misalignments in your spine, the disc also becomes irritated. Now, there's multiple things that can happen to the disc. So it can be, over time, it will begin to degenerate if there's a lot of stress on it. And as this begins to degenerate and there's no padding in between these two, that hole will begin to get smaller and smaller. Well, another thing that can happen is, say if you have some kind of trauma, and it could be even simply as something as just bending over to pick something up in the incorrect position, and if everything aligns, you may have some kind of disc herniation. And the reason I bring that up is because it's one of the number one causes of having sciatic-like pain. Great. Okay. So there's three main common causes of sciatic pain. And that's one is a disc herniation, or they also call it a disc bulge, which is a minor form of a disc herniation. They'll have formation of bone spurs due to some kind of disc degeneration, which we had talked about. And then it's also having a tight piriformis. Okay, and we'll talk about exactly what that means. So let's look at this little diagram right here. So as you can see, this is the same one as the previous slide. And what we're seeing is that this disc right here, right in between these two vertebrae, has herniated, and it's caused some kind of irritation on this nerve that's coming out. And what this is showing is a bird's eye view from top down, at one slice of it. And what this is showing is this is your disc, and this should be a nice kidney bean shape. So as it comes around here, it's fine, fine, fine. As soon as it gets to here, right, there's a bulge. This is the disc bulge, and it's compressing on this nerve. And this is what causes your nerve to become irritated. Okay, so these two pictures together right here. Now when we look at this picture over here, this is when your joints become inflamed. Now I want you to focus in on this blue area. That is the disc. You see how this disc is healthier, even though this disc had herniated. It has good disc height as well. This one is very degenerated. So this happens over a long period of time. Say your spine becomes misaligned, you go through a lot of stresses, and that disc space begins to degenerate over time. And this will cause this intervertebral foramina to close up the hole, to close up, and it will cause some nerve irritation. Okay, and then the last way to really get it, these are the most common ways, is to have a tight piriformis muscle. So you have a piriformis muscle that will attach from your sacrum to your hip. And I think I have another, yes, I have another slide for this. But ultimately, what will happen is that muscle will get tight. And because the nerve runs underneath it, it will cause it to become irritated. Good. Okay, and this is pretty much what I was talking about before. And also, I just want to go back to this. Let me go back. In the green here, you see how there's all of these nerves coming out. So they come out at different segments, and it could start at L3 or L4, right? So your third lumbar from the bottom, right, will start having nerves that come out, and they will all combine all the way down from your L3 all the way to your S2, S3. All these nerves will come out and it'll combine to make your sciatic nerve. So you can have problems in any one of these areas, and it can cause this sciatic, like sharp shooting, dull, icky, numbness, burning pain. It's a lot of symptoms there. All right, so going back to the piriformis muscle right here. So, like I said, this is one of the common causes of sciatic pain, and they call it Piriformis Syndrome. And this is synonymously used with sciatic pain. So the Piriformis Syndrome is named after the piriformis muscle, and it's located in the lower part of the spine, like I had mentioned before, next to the thigh bone, right? And the main job of this piriformis muscle is to help with hip rotation. So as this muscle contracts, it will bring this is your femur, it'll bring your femur over and help with rotating, help with in hip rotation. And the sciatic nerve will run below this. Okay, so you can kind of see based off of the relationship that when this gets tight, it can cause irritation. But that's not the only thing with it. The problem is that on top of this sits your glutes, okay? And we use our glutes a lot, okay? And it is actually a muscle that, the piriformis muscle is a muscle that is very susceptible to becoming injured. Say you have a slip and fall, say you have some sort of hip arthritis, or even a difference in leg length. We see that a lot is if you have a significant amount of leg length difference side to side, femur head can actually pull this piriformis muscle downwards, and it can cause your sciatic nerve to become. And when it becomes entrapped, generally your piriformis muscle will have some sort of cramping, there'll be spasming, and ultimately some kind of inflammation. Now, sciatic pain generally will cause some kind of loss of feeling, and this is more so a sensory loss. So you may feel like at the bottom of your feet, the sole of your feet might be numb. Now, there's other things that also can cause you to have sciatic pain that are less common, but it does happen. I'd like to mention them. One is childbirth and pregnancy. You're often, you have a large amount of weight right on your body, and it's putting a great deal amount of stress onto your spine. And also during pregnancy, your hips right are super mobile. You have this hormone called relaxin that runs through your body, and it allows your baby to drop, your hips to spread, and then but the problem is when it comes back, right, it doesn't always come back in the correct position. That can cause some problems. Not corrected. Some other things that I can think about are spinal tumors. This is more of a rare case. There's some also non-spinal disorders such as diabetes, even sitting on someone who consistently has a wallet in their back pocket and sits on that side can have sciatic pain on that side as well. Good. So here are some risk factors. So we pretty much went through what is sciatic pain, how is it defined. Now we know three really main common causes of it. Let's talk about some risk factors. So I mentioned before that age is one of the common risk factors for getting sciatic, and that's mainly due to degeneration. When your spine has gone a long period without, uh, in the incorrect position or say poor postural issues, your spine acts as a suspension system, and it can load those forces in incorrect areas and cause your body to form bone spurs and obesity. So this kind of goes hand in hand, with diabetes in a sense, where you generally have an increased amount of weight, and it uh, has a tendency to put a lot of stress onto your spine, um, which will cause your bones to degenerate. Went through pregnancy, diabetes, right? Diabetes increases the chances of having nerve damage, and that is mainly due to sugar. So when your body is unable to process sugar well, um, that can lead to having some kind of nerve damage and irritation. I'll talk a little bit about that in a later slide. Good. Moving along. So I just like to talk about some common medical treatments that are pretty common when people go into the doctor to get treated for sciatic pain. So commonly there will be prescribed some kind of, or they'll just ask to go get some over-the-counter drugs, which are NSAIDs. NSAID stands for non-steroidal anti-inflammatory drugs. Okay, so the reason they do this is your ibuprofen, your acetaminophen. The reason they do this is because they're helping deal. They're trying to help you deal with your pain, and it helps with inflammation, right? But it is also something that can be very taxing on your liver and kidneys over long-term use. So it's more so of a temporary relief to allow your body to heal. Then you have physiotherapy, and they kind of go in particularly this order, right? From greatest to least. Um, for physiotherapy, this deals more with the musculature and the rehabilitation of muscles. So especially with the piriformis muscle, right? So there's a lot of stretches out there for the piriformis muscle in particular. But remember, this is only one of several different ways that can cause you to have sciatic pain. And they always try to start from non-invasive to invasive. Um, then you have steroids, right? This is the cortisone. So this is a shot that's given, directly, generally where the pain is at, and mainly used to suppress the inflammation, right? But it's rare, and often takes multiple shots to uh, effect. Some people get immediate results, but generally, once again, it's pretty temporary. And then another thing that we see is also the use of nerve blockers. So this is a type of medication, and it's actually considered an anticonvulsant. For more epileptic patients or patients suffering from seizures. But what we see is that it's pretty much prescribed as a nerve blocker to help patients with. And then lastly, and this is more so rare, but we do have patients who come in who do have a laminectomy or a discectomy done, right? So a laminectomy being that the nerve is being compressed by the bone. So what they'll do is they'll go in there and cut that entire bone off. Um, it does expose your spine, your spinal cord, but patients, they do this for raising the patients who have some sort of relief. They'll do a discectomy, which is removing the disc. If there's an untreated disc herniation, or if there's less non-invasive ways to be treated and it's not working, then they'll this is more of a last resort to go in there and let's move on to exercises. Okay. So here are some, I'm going to give you 3 common exercises that are done. These are all, PT exercises. So first one is going to be the piriformis strip, right? And this is with the assumption that your piriformis muscle is tight, but it's always good to stretch this out. Generally, people do have a tight piriformis muscle. Okay, on the left is a QR code for our Lot 5i YouTube channel, but we have Rachel, who's uh, our office manager, who actually makes these videos, and she did the piriformis stretch. There's a bunch of videos on there as well. So it's a 5-minute video. You can follow along in real time. And I'll leave this up for a couple seconds so that you guys can grab that. If you guys don't know how to use this, you just pull up your cameras, you point it at the screen, and you'll have a little drop down that comes on. You just click that, and it should take you right. Okay, here's another one. Right, this is called the Pigeon Strip, and ultimately you're still doing the same thing, right? You're still trying to stretch out your piriformis muscle. So on the left is more of a starting in a beginner's position where you're seated. You have your leg crossed over. That's parallel to the chair. And then you're just applying a little bit of forward hip flexion. And then you're really brave. You can work your way up to what she's doing on the right, which is considered the full pigeon strip. This is obviously something that not everyone will be able to do right away, but you can work your way up to it if you're seriously having problems with your piriformis. And then I think I have one more, and this one is actually a really good stretch for mostly everybody. It's a very well used PT move. It's called the cat-cow stretch. And pretty much what you're doing is, as you can see, you're on all fours, and your hands are at shoulder length, and your hips are right over your knees. And all you're doing is just flexing and extending your back, not as fast as this woman is doing, but in a slow manner. And as you inhale, you want to be flexing, and as you exhale, you want to be, okay? Once again, this is another QR code to the cat-cow stretch. This is an excellent stretch for your spine, especially people who have sciatic pain. It really helps with supplying movement to the spine. All right, so let's talk a little bit about prevention and what you can do to prevent it from getting any worse. So first thing is exercise and eat healthy. I can't emphasize how much that this will really change how your body responds to you having sciatic pain. We have another recommendation here that's 15,000 to 2,000 milligrams of vitamin C per day. So vitamin C is an essential nutrient, and it's involved in the repair of tissue and also enzymatic production of your neurotransmitters. You want to make sure that your neurotransmitters are functioning really well, and that signal is being sent along that nerve pathway. You want to avoid applying heat. So taking hot baths, even hot showers for long periods of time, heating pads. When you have nerve issues, heat is not going to be your friend. Now, generally, heat can be used to calm down muscles, such as the piriformis muscle. But if you're having sciatic-like pain, we would not recommend. We would actually recommend the opposite, to ice that area to help calm down potentially any inflammation or nerve inflammation that may be going on in those areas. We would tell you to avoid prolonged sitting, right? When you have sciatic pain, we want as much movement as possible. The more you're moving, the better. And then lastly, chiropractic care. So what can chiropractic care do for your sciatic pain? We'll talk about that in a slide or two. So let's talk about the diet portion of it. There's 2 things that you really, there's many things, obviously eating healthy is most good, but the 2 main things, especially when you're having sciatic pain, to stay away from is sugar and gluten. Okay? So I'm going to begin with the sugar. So this leads to having diabetes, but not just that, right? when sugar is left in your blood, right, so what happens is you can get nerve damage, and that nerve damage can affect your hands, your feet, your legs, your arms. And when you have high blood sugar, right, it can lead you to have what's called a diabetic neuropathy, and can really and you can prevent it, or slowly progress it by keeping your blood sugar as close to the appropriate limits, to maintain a really healthy lifestyle. And then there is gluten, right? So 18 million Americans suffer from gluten sensitivities, and you may or may not be one of those. But sensitivity to gluten in the diet has been tied to having some sort of nerve damage, known as neuropathy. And so reducing these items, sugar and gluten, will really help with that. Now, I want you to think about, what you're having for dinner tonight. Okay? And I want you to think about also, does it have gluten or sugar in it? And I would think that, most people would have gluten or some kind of sugar in your diet. And if you're, suffering from the sciatic-like pain, it might be a good idea to, reduce some of those things. You'll be amazed at how much it really helps when you reduce these two products and how much you consume them. I would also recommend a diet logging. At the end of the night, log everything that you just ate that day. See what has sugar in it, what has gluten in it, and see how that's affecting you. Okay, so how can chiropractic care help with all of this? So we mentioned the three top things, right? Disc herniation, we call it syndrome, right? That's when you have degeneration in your spine, causing that foramina, that hole, to get smaller and smaller, and then piriformis syndrome, right? So ultimately, chiropractic care will look for areas in the body that are experiencing some sort of nerve irritation. We're always scanning people, okay? And when we find some kind of nerve irritation, in that area of the body, there's some sort of interference. And chiropractors work on removing that interference from your body. Now, we are constantly looking at the biomechanics of the spine and where your body has become misaligned, where those nerves are becoming entrapped. Okay? Those misalignments will lead to you having some kind of nerve compression, and when the nerve becomes compressed, that energy that flows through those nerves becomes diminished. And when you have those diminished nerves, the electricity is kind of turned off. This is why when people do have sciatic pain, they will tend to have, loss of function of, their foot, their leg, all sorts of issues. This is just one study of many. For those of you who come to my talks a lot, you'll see I put a lot of research on it, but nearly 87% of people with disc herniations or issues like that will find improvement with chiropractic care. Okay, and that's it. That was a quick 20 minutes, I believe. Good. If anyone has any questions, that's all I have for you tonight. I'm going to wait a couple minutes around and answer any of your questions that you may have. I have a question here. So it says, how long is it going to take chiropractic to relieve the pain? This is a really, a very subjective question, because it depends on person to person. It depends the severity of the case. Some people might just have a tight piriformis, and stretching it out might relieve their pain entirely. And that might take a couple visits here and there. Some people might have a really more severe case that have been suffering from sciatic pain for many years. Now that's going to take a little bit longer, especially if they have, the other two, the disc herniations or the degeneration in the spine. So it really does depend on person to person. We have another question. Can you advise on diet, like more intake of? So mainly what we want to do is it's more so what not to eat, right? Um, so if you actually, I would highly encourage everyone to start actually looking at labels and looking at um, what they're actually consuming, because a lot of those things, your bread is not just bread. Okay, I guarantee you that the bread that you get at the grocery store has a bunch of sugar in it, may have definitely has gluten in it, um, and a variety of different things. Diet logging is going to be essential. Staying with the common fruits, vegetables, um, even having quinoa or brown rice instead of white rice. Uh, I hope that answered your question. Right. We have another question. I have okay, so I have a hairline fracture of my tailbone. How long does it take to heal? And can a chiropractor assist me? Yes, absolutely. So healing is going to depend on how bad your fracture is. It could be, it could be 4 weeks, it could be 6 weeks. Generally, with a tailbone fracture, um, there's not any kind of like stent or splint that they put on that. It has to just naturally. Um, but chiropractic can definitely assist with making sure that that bone is in the correct position as far as how it heals. And I'm guessing if you have injured your tailbone in one way or another, you probably had a slip and a fall. Now, slip and falls can generally throw off your hips. Your sacrum, which is attached to your tailbone, is the base of your spine. And now, if the base of your spine gets thrown off, like I've seen in many x-rays before, it throws off the entirety of the spine. So definitely need to get that fixed. All right. Another question. So why is heat bad, but ice is good for you? So heat is, so I want you to think about inflammation, right? When there's some sort of uh, irritation or something going on in your body, say you will make it really extreme, say you broke your bone, generally there'll be some sort of swelling in that area. Now, what that means is that there's a lot of blood pooling. Okay. Now, when blood starts to pool, right, applying heat is just going to make that blood flow move much faster. And blood, one thing blood does is blood will lyse your bone, which is not good. That's why we always want to apply ice to reduce inflammation. So after we do adjustments, this is why we tell all of our patients that you may be a little bit sore because we are putting a force into your body. So as you get adjusted, you may feel a little bit of soreness and you may get a little bit of inflammation. But there's two reasons that we recommend that they put ice in those areas is because first, it'll help with the pain, but second, and most importantly, it helps reduce that inflammation. Okay. Good. I think I've answered all of the questions. Thank you, everyone, for coming to the talk. I hope it was informational, and I hope that you guys learned something. We're going to have a new patient orientation on chiropractic on the first Wednesday of the month of February. That's going to be February 3rd, same time, 7 p.m. Please join us there. You guys will learn a ton about chiropractic and what chiropractic does for your body. Thank you.